So maybe a first question would be, give us a state of just your tribes. Madison has just been designated in December, Truax Field, as the home of F35A. Doctor, can you start? Give us an overview. In 2018, law enforcement agencies surveyed by the State Department of Justice reported 9,464 emergency detentions. It's a growing problem draining the resources of law enforcement agencies. Attorney General Josh Kaul recently convened a summit on the problem, and I'm going to welcome Attorney General Kaul and Dane County Sheriff Dave Mahoney. Thanks very much to talk about emergency detentions. I didn't know a lot about this until thanks to your office for the briefing papers. Talk about the emergence of this as a problem first, General, and then Sheriff.
Well, first of all, thank you for having us on your show and raising attention to this important issue. As you mentioned, this is an issue that certainly doesn't get a lot of attention, but it's one that's really important for a few different groups of people. It's an issue that I hear about from law enforcement around the state all the time because, as you indicated, law enforcement officers need to spend a lot of time working with people who are being brought into the emergency detention process. It's also a big issue for hospitals that deal with this, and it's a big issue for people who are suffering from a mental health crisis because the process that we have in place right now is certainly not as efficient of a process as we'd like. So we are hoping to move forward with some discussion to hopefully get some of the best ideas for reform on the table and ultimately move forward with reform.
Thanks, General. How have you seen this over your experience as Sheriff? Did this problem change?
You know, our nation's sheriffs, in particular here in Wisconsin, have become the largest mental health institutions in our country. And as it relates to Chapter 51...
Is that part of your job description? Sheriff? Mental health counselor?
Well, public safety, but
okay.
Being a mental health counselor or being a psychiatrist is not part of the job description, nor is it what we prepare our deputy sheriffs to deal with every day. Although, because it's been thrust on us, right, we do a good job of it.
So it's, you've seen this problem grow.
It's grown
exponentially.
It certainly has. Not a day goes by that we aren't dealing with a mental health crisis somewhere, whether in our jail or out on the road with our patrol deputies every single day. And we just hope that it doesn't rise to the level of Chapter 51 because we know of the time impact and the economic impact of having to pull deputies off the road and then subject an individual to being handcuffed for hours in the backseat of a squad car and the additional trauma that causes.
Remind us about what the Chapter 51 process is, Sheriff.
Chapter 51 is a Wisconsin statute that covers a law enforcement officer's ability to take somebody into protective custody and detain them for observation for 72 hours.
Okay.
And then the process that goes into it is really what we're dialoguing today.
Okay, General, let's work with some of the items, the materials from your summit. Let's look first. How does an emergency detention work? First of all, let's define it. Law enforcement takes the person into custody because they have reason to believe the person has a mental illness and is a danger to self or others. How are these normally reported? A family member? And how often are weapons involved? Are they dangerous situations for your deputies?
They are. This incident could be reported by a family member, could be reported by the general public. Somebody's acting out in the community, armed or unarmed, where their behavior clearly is an indicator that they're a danger to themselves or to others in the community. Then law enforcement responds and has to make that determination whether this is an individual who's suffering from a mental illness, which is really the foundation by which their behavior is coming from, and then to take them into protective custody to disarm them or try to place them in a mental health facility where they can be safely cared for.
General, are there different abilities of law enforcement agencies to deal with these emergency detentions? If you're the only deputy on duty in Price County at 2 o'clock in the morning, that's different from the city of Milwaukee or Dane County, correct?
It can be. And one of the challenges that's in place right now is it's often difficult for law enforcement to figure out where to transport somebody if there is a mental health crisis. And there are a few things that go into the process. First, if there's an available bed space for somebody who does need to be detained at a nearby hospital, that's certainly ideal for law enforcement because it gives them an option to go somewhere close. But there's only one statewide facility that accepts people for emergency detention, and that's Winnebago County's health facility. So in a lot of cases, law enforcement needs to transport these folks from wherever they are in the state, whether it's Price County or Dane County or elsewhere, to Winnebago County. Before that even happens, though, they need to have medical clearance to make sure that the person will be safe at Winnebago Mental Health because there's not broader medical treatment options there. So if somebody has other health issues, they need to be addressed first. So there's a lot of time that goes into the process of determining where the person will be taken and then doing the transport that goes into that.
Now, you had your agency do a survey of law enforcement agencies, and more than 355 law enforcement agencies responded. Why did you have that survey conducted?
One of the things that has come up the most as I've been talking to law enforcement is this issue of the amount of time and resources that go into emergency detention. And you hear from officers about both the time and also their concern about people who are suffering in a mental health crisis. And they want to see change to the system. That is a clear message that has come across. And I heard that a lot in conversations I had with people. And so we wanted to step back and say, let's not just work based on anecdotes. Let's gather some data and see exactly what impact this is having to the extent that we can. So we collected data from around the state, and the data is consistent with what we've heard, which is that this is a major concern for law enforcement, and it's eating up a lot of resources as time gets devoted to this process.
Biggest surprise that you found from your survey of more than 355 agencies, sir?
One of the things that I thought was interesting, one of the issues that I've heard about a lot is the amount of transport time because of there only being one state facility. Yeah. But a second major issue that became clear to me from the data is that officers would really like to have a more consistent medical clearance process. One of the things that can be a challenge is sometimes if it's this hospital that's doing the clearance, officers might need to provide a certain set of information. If it's a different hospital, there might need to be other information. And to some extent that makes sense because any two people who are brought in on an emergency detention are going to have different challenges and you might have different concerns as a doctor. But one of the things I think we can look to do, and I hope our summit helps us move in that direction, is start developing at least some consistent processes that go into the clearance process so we can start to reduce the amount of time for this process.
Let's go back to this first graphic in terms of process. There's been an emergency call and there's an emergency detention situation, and then law enforcement officers transport the person to a hospital, a health facility, usually an emergency room. Can you walk us through this process then, Sheriff?
Certainly.
So what happens next?
So that individual is taken to an emergency room. They're not able to leave. They're actually in police
And
custody.
how many officers are with them?
Usually two.
Two.
That's for the protection of the individual and protection of law enforcement. And so they go into the kind of the call or the queue, if you will, at the ER based upon medical need. And so they may be medically sound but need to be checked out.
Okay.
So somebody with a bleeding injury is going to take priority. So it can take hours to sit in the emergency room. Our deputies and officers have reported hours sitting in an ER waiting to get that medical evaluation to be seen by a physician. They're seen by an ER doctor to get the okay that they can medically, there's nothing medically wrong with them.
So they're cleared from a medical standpoint.
Yep.
And
they can then be transported up to Winnebago Mental Health.
But
So then in Dane County's case, we have a countywide mental health overseer. We check in with them to make sure that based upon what we've seen and heard meets their criteria for authorizing a transport and housing, because it's $1,000 a day to house somebody at Winnebago. So they sign off, then it's a 2.5-hour drive with that individual handcuffed behind their back in the back seat of a squad car for 2.5 hours, gosh, to be housed at Winnebago Mental Health.
who pays that $1,000 a day at Winnebago?
The county taxpayers.
County taxpayers. So, General, there's go back to the flow chart here. So, police consult with a county crisis provider. Does the crisis service determine that detention is necessary? There's different options there, yes or no, and that would depend on whether the person is transported. Now, the materials from your summit, 34% of transports go to Winnebago.
That's right. And actually, that's because there are a number of hospitals around the state that, at least in some circumstances, are able to step up and provide bed space. And that's a good thing. But one of the challenges that's presented is it's not always consistent for officers. And so sometimes there will be a nearby facility where they can have somebody detained. But in other cases, they'll try that facility, they'll call them, and then it turns out they don't have space available. And so they end up sort of going down a list before they finally get to Winnebago, which is the one safety net facility for the entire state.
Okay. As an example, that person may have a history with the local hospital, may have been a patient there before, and so they may be able to, during the medical evaluation, through discussions with that individual, do a voluntary commitment to a local hospital. That's
one of the options.
That's one of the options. Or Dane County Mental Health could say, we're okay with that person being at home with their family members because they've been through this before, and they don't authorize the Chapter 51 hold, but they authorize to be released to family members. That's an option, not the best option.
Understand.
Because oftentimes we're called back to those situations.
From your summit, the information, average duration of an emergency detention incident, 8 hours. Median incident duration, 5.5 hours. The longest one was 119 hours, almost 5 days. Either of you know which county or which local law enforcement agency dealt with 5 days?
I don't remember which county it was, and I'll mention with those averages. That's I believe per officer, and often it's more than 2 officers per incident once you include all of the parts of the process for the reasons the sheriff was mentioning before. But what can happen is that this is an involuntary process when it comes to the detention, but the parts of this that happen before the emergency detention takes place don't necessarily give officers the full authority to make sure that whatever tests need to be conducted are. So you can have a situation where law enforcement brings somebody to a hospital and they say they're not going to consent to tests, or they may just not provide any answer at all. And so you can be in this unfortunate standstill situation where you've got to wait out to see whether the person ultimately consents to the tests. So that's one of the areas where hopefully we can work to clarify the law and improve it so that we don't have folks just waiting around as this process plays out.
If the person is non-responsive, is that when you get in the county crisis coordinator to make the call? Do I have the process right, or am I
Well, if they're non-responsive, then you take into account the actions that were seen by the officer and how those are articulated to decision makers, to the county mental health care provider, to make that determination for them to say, yeah, it meets the criteria of Chapter 51.
Okay. And so these incidents can last a long time. Walk us through. So a typical incident here that ends up in your officers taking somebody to Winnebago. So initial call, taken to an ER, assessment, then 2 officers drive that individual to Winnebago?
2 officers are going to go to the ER with the individual,
okay,
to make sure that there's ample, safety for both the officer and the individual while they're at the emergency room. So you've got 2 officers locked up right away and not answering calls for service or on overtime. You may have called somebody in on overtime. Then while you're at the ER, it may be, as the general said, it could be an hour, it could be 5 hours, it could be 12 hours to get that medical clearance. At that point, then, you're loading up into the squad car with the individual in the back seat, handcuffed, and then for Dane County, it's a 2.5-hour drive.
To
Winnebago. If you're in Pierce County, it's probably a 5-hour drive or longer.
Yeah.
If you're coming from Ashland, it's a full day drive.
The materials from your summit said that the average person involved in this emergency detention is 34 years old, almost equally male-female. Did that surprise you, or anything on that summary?
It's
noteworthy?
It's reflective of who we are as a population in Wisconsin, and the reason for that is that people of all different backgrounds can go through mental health crises, and when they do, sometimes people exhibit behavior that indicates that they may be violent or they may be a danger to themselves, and that's when law enforcement gets called into these situations.
Okay. Now, let's look at another result from your survey. Let's look at that. How concerned were these law enforcement agencies, about the impact of emergency detention transports on your agency? I find it intriguing. 73% of the agencies responding, again, more than 355 responses, were very concerned. 14% somewhat concerned. Total 88% either very or somewhat concerned. So this is a huge issue that they have to deal with, correct?
That's right, and I have to say I'm a little surprised by how large a percentage that is, but I'm certainly not surprised to see a lot of law enforcement agencies saying this is a big concern, and that's because with only one statewide facility, you're going to have officers impacted all around the state by this process, and that's what we've seen in the numbers.
I bet you weren't surprised by the 88%,
I'm not surprised at all. It's the number one issue that in Dane County that our Chiefs Association talks about is the transport. You know, you gave the example of a small sheriff's office. It's not uncommon in Dane County for one of our smaller departments to get caught up in an emergency detention where there's one officer on duty. So a deputy then accompanies that officer to the hospital. So now we've got a deputy and an officer tied up, and the backup police calls are being handled by the sheriff's office.
Right.
So while they're out of their community, the sheriff's office is in the community handling police calls. So in essence, there's three people tied up. And so from a time standpoint,
yes,
it's a huge issue for law enforcement for a cost, because of overtime costs. When we talk about the transport to Winnebago, there are agencies that when they take a Chapter 51 to Winnebago, they then have to get a hotel room before they can head back home the next day. So there's the additional cost of having to pay for a hotel room for that police officer because they've been on the road so long.
Okay. Which is a perfect segue to another part of the materials from your summit. Your survey of local law enforcement agencies, how much do you think emergency detention incidents impact your agencies? One, staffing levels, 78%, either great extent or somewhat. So the total there is, 78 plus 15, that's a huge majority. Budget, 44, great extent, 35, somewhat. Officer safety intrigues me, Sheriff. 30.8% to a great extent, 42% somewhat. Explain the potential dangers in emergency detention situations.
Well, you're dealing with somebody who's in extreme emotional crisis and maybe physically aggressive, maybe armed with a weapon, maybe in a mental state that general law enforcement. Some agencies are actually seeking out and training their deputies and police officers in advanced crisis intervention training, de-escalation training, understanding mental illness, all the different diagnoses, so that when they're in the community dealing with these situations, they can actually identify the type of mental health diagnosis. Those are the issues that we're dealing with that pose a public safety issue. And then having to, it's a problem. Law enforcement doesn't like having somebody strapped in the back seat of their squad car for prolonged periods of time. It's not healthy. And so they worry about that, and that's an issue.
So this is what you're hearing from local police departments, chiefs and deputies, that they're most concerned about staffing and officer safety, right, General?
That's right, and the impact on the budget. And one of the things about staffing I think it's important to emphasize, in addition to the time that goes into it, is that law enforcement can't predict when this is going to happen. And law enforcement is already often responding to things that they don't know are going to happen at the beginning of the day. But particularly when you have a small agency with limited resources, all of a sudden having an officer who's going to be on the road transporting somebody for an entire shift and maybe more can really complicate planning and make it much more difficult for agencies to staff.
Well, one of the respondents to your survey said in some cases, our village, so it's a tiny community, can be without police services for 24 hours. So there are public safety ramifications to this issue, right? Because your officers,
Certainly.
they're at the ER transporting to Winnebago, they're not doing what?
They're not answering calls for service. And in that situation, that example you gave of the village, the calls for service are probably being handled by the sheriff's office, but they're not sitting in that village waiting for that call to come in. They're already handling many of the other police calls that they're normally handling in the county, but in addition, they're taking on the added responsibility of answering calls in that village when they come in.
Okay, General, let's turn to some potential ways to alleviate this problem. Your thoughts and the options that you've heard and are working on, sir?
One of the reasons we had the summit was because we wanted to get ideas on the table and bring people together. It's a complex issue, and it involves a lot of impacted parties. It involves healthcare providers, law enforcement, advocates for people who have mental illness, among others. Counties are involved in the process. So we wanted to start brainstorming ideas, and we are not at a point where I think we have a set of proposals. We want to say these are ones that our office is going to recommend that the legislature adopts. But that said, there are some clear areas where I think we at least ought to be looking at potential changes. So some of the big picture items, one is figuring out if there's a way that we can potentially make more beds available for emergency detentions around the state so that we don't have as many transports to Winnebago County. Improving the medical clearance process so there's more consistency, which is something I'm hopeful that we'll be able to work with hospitals and others on, I think is a possibility. Looking at ways to divert more cases so that people don't end up in emergency detention, whether that's by funding more respite centers or peer support programs where people who may not necessarily need to be in a secure facility but also are still a danger to themselves can be in a position where they're safe but they're not in as restrictive conditions is something that I think is interesting. And then figuring out alternatives to transport, whether we can have private transport options, for example, potentially having remote appearances at court proceedings to minimize the number of trips. Those are some of the things. There are others that I think we ought to be considering as well. And what I'd like to see is people coming together and debating these issues and working to find some solutions here, because this is something that impacts agencies across the state. It impacts police, it impacts sheriffs, and I think there is an understanding that we need to do something, and we're going to work to bring people together on this.
Question for both of you. Do other states use private transport services? And have they had problems since they're not trained law officers, sir?
There are actually some agencies in Wisconsin that use private transport. The law is a little bit unclear on that, although there's a presentation at our summit about this which suggests that it's permissible, but it would be good to see some clarity on that. Different states do different things all around the country, and one thing that I think is clear is that this is a challenge for all sorts of jurisdictions. It's not unique to Wisconsin. And it's never going to be a situation where this is not imposing any time burden on law enforcement. But what we want to do is work to make improvements that we can. So in Minnesota, for example, they have a bed tracking system so that law enforcement can look and see immediately where there's available bed space for detention. Looking into whether that's the type of thing we could develop here in Wisconsin as well is one of the other areas I'm interested in pursuing.
Well, taxpayers, they only want to know when the delay in a response time to an emergency. So my question is, do most citizens, are they not aware of this emergency detention issue and the burdens that it's placing on our law enforcement agencies?
One of the reasons that we decided to hold the summit on this topic is we want to draw attention to this issue to make sure that people are aware of the burdens that it's imposing. And there are a few different ways that it impacts people. You heard about the diversion of law enforcement resources. That both means that taxpayer resources are going to that and that public safety is being undermined because we have more officers off the street. County Health and Human Services resources are going to this as well. And people who have a mental illness are put in this very difficult position as a result. And that's something that can impact anybody's family member. So we need to make sure we've got a system in place that's going to make sure that it's effective for people who do have those mental health issues and it's effective for our law enforcement officers.
Sheriff, of all the potential options that are being considered, which one do you think has the most potential to help with this very pressing problem?
Well, I think it's it's a holistic approach. It isn't one solution. I think that identifying open beds and creating more beds,
kind of the Minnesota model,
is certainly a preferred outcome. From a staffing standpoint, I think that if we can find a solution utilizing private transportation that ensures the safety and integrity of law enforcement's custody of that individual, I think is a good opportunity.
But you've heard of you've heard of some horror stories nationally where transport those driving these transport vehicles were not very well trained and not good outcomes. So what type of standards or certification?
Well, I think we're still in the infancy of talking about what that certification should be, because right now it's a trained law enforcement officer.
Has to be, right?
And
this is where there's some ambiguity in the law, and I think there's actually legislation that's pending right now that would clarify that. But I think everybody would agree with you that if we do have transport that's not law enforcement, you'd need to make sure you do it in a way that's safe and secure, and that you're going to have confidence that the process is going to be handled appropriately.
Is this a matter of more money, or is that too simplistic an answer?
I think parts of the solution are a matter of more money. I think there are other areas where coming together and sharing best practices from county to county can be helpful. I think figuring out ways that we can, a good example where money may not be involved is in trying to make the medical clearance process more consistent. That may be just a matter of bringing folks together and reaching agreement. But when it comes to more bed space and more facilities, it's not an accident that there's limited access. It's because hospitals lose money when they have to put money into building the kind of secure space they need, and then they lose money when patients come in. So we've got to figure out a way that we can either incentivize hospitals to have more bed space available or have more options that the state is providing so that not everybody's traveling across the state.
Is the context here tragically the fact that not only Wisconsin, but America is dealing with more mental health issues, General?
That's part of the cause here. DHS presented at our summit, and one of the things they talked about is that when we're talking about long-term solutions, one of the things we need to do is make sure that greater access to mental health services is available to people. If we can make sure that more people are getting the services they need before they're in crisis, that's in everybody's interest. It's going to help the people who are struggling with mental illness, and it's going to reduce the costs that go into an emergency detention process.
Are policymakers, our elected officials in the Capitol, the governor and lawmakers aware of this growing problem yet? Or
I've spoken to a number of lawmakers about this issue, and I will say that I think there is a broad understanding that this is a real issue and that something needs to be done. Because of the complexity of the issue, though, I think it's one where we need to keep bringing people together, identifying solutions, and ultimately putting some proposals on the table that hopefully will become law.
Okay, we're almost out of time. Final question.
It's bigger than just the fiscal impact.
Please,
There's
Dave,
a human cost.
Yeah.
There's a human cost
Thank you.
to individuals who suffer from mental illness, who are forced into a situation where law enforcement is their protector. And we need to ensure that that human cost is decreased.
Okay, we're almost out of time. One last question. Next step as both of you address this problem. Next step, Sheriff?
Next step is we need to continue this conversation at the Capitol and in expressing how important this issue is. Badger State Sheriff's Association is leading on behalf of our 72 state sheriffs. I know that the Chiefs Association is very involved, and I have to hand it to the Attorney General for hosting his conference here. It really brought into the sunshine the impact that mental health and these transports are having on public safety.
And next steps from a statewide perspective, General?
We're going to start reviewing or continue reviewing some of what was discussed at our summit and start putting together a list of ideas that we think are worth considering and bringing to a group that includes stakeholders from all these different impacted areas and start identifying some concrete solutions. My hope is that we will see some both ideas about best practices that can be shared and also some proposals for potential legislation.
Okay. And just a programming note, WisconsinEye was at the Attorney General's Summit, so all those sessions and the materials are at wisconsineye.org. Sheriff, thanks very much.
Thank you.
General, thank you so much. Thanks. Important issue. Thank you.
Thank you.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol. WisconsinEye would not exist without generous donors like you. Please visit wisci.org to make a donation today.